IVF is not the answer for everyone. So let's talk about what inspired that and really what you mean when you say that.
Okay, I'm crazy doctor. You probably won't see a lot of fertility doctor telling you you don't need IVF. But what I'm trying to say is this. First of all, I see a lot of patients who stressed out. And let me tell you one thing, and this is something pertinent to you. Do you know how many patients I just talk to them and after the consultation they get pregnant naturally? Because they have been exposed to a lot of negative things. And I can tell you the brain half of the game. And now I joke with them and give them things that could be done, and they feel like, and that significantly help pregnancy. That's one. Now, the second thing that I want to talk about is I see a lot of patients who had IVF before and who had miscarriages before, and now they can't even make an embryo. If someone is getting pregnant and having miscarriages, it means naturally she ovulated one egg that was mature, that fertilized, they made an embryo for blastocyst to stick, they made it to the uterus, that stuck, but she miscarried. Fair? They tell them now you need IVF, they pump her with high doses of shots, 20 eggs, now they don't even make one embryo blastocyst. That was not her problem. The problem, she was making blastocysts naturally. Now she can't even make blastocysts. And I tell her you need donor egg because the high dose of drugs, whether people like it or not, it's actually bad for egg quality. Out of 100 hysteroscopies I do to look inside the uterus in women who already had previous hysteroscopy, 99 out of 100, I find something that I fix that could be causing miscarriages or failed implantation. I'm not saying I'm better than anybody by hysteroscopies, but I really think you need to be very OCD. I always describe my hysteroscopies as okay, the uterus is a room, and if you come clean my room, I'll find the spot that you missed just because I'm pain in the ass. This is how it should be because you're dealing with embryos microscopic. So if I can see a little scar that was left, that's a huge deal for the embryo. That's the only thing. I see patients all the time can't get pregnant. They do IVF, can't get pregnant. They need the donor egg, not get pregnant. All of it long. If the uterus is not receptive, IVF, whether you put donor egg or someone else, it's not going to stick. So that's why I said IVF is not always the answer. And I can tell you a lot of my patients, I would say 20% of my patients that I helped get pregnant is without IVF.